Talk therapy often involves the use of words. What is that experience like for clients or therapists who are bilingual or multilingual? Have you ever found yourself or your clients searching for the right words, feeling that what you or your clients truly mean just isn't quite captured in the English language? Imagine that feeling amplified in therapy, where every nuance matters. How might psychodynamic principles help us explore the profound associations of language, particularly when working with MENA populations? We'll uncover how the unspoken, the culturally embedded, and even the affect-laden in the mother tongue shape our experiences and can be both a bridge and therapy. Welcome to People of Color in Psychology, the show that explores mental health topics specific to culture, diversity, and communities of color. I am your host, Jack Sun. I'm thrilled to introduce our guest speaker today, Dr. Rebecca Moussa, a clinical psychologist and owner of Finding Curio, Psychological Services LLC, where she provides psychotherapy and evaluation to individual and families, both children, adolescents, and adults. Dr. Moussa holds a Doctor of Psychology degree from Antioch University, New England, where her research focused on psychoanalytic and psychodynamic practitioners. Her commitment to the field is evident in her work, spanning from individual, couples, and family psychotherapy to in-depth psychodiagnostic evaluations. In addition to her private practice, Dr. Moussa serves as a staff psychologist at a university in Boston, where she conducts psychological assessments for religious leaders in formation, as well as clergy wellness evaluations. Dr. Moussa is also dedicated to the professional field of psychology, holding leadership positions in the American Board and Academy of Psychoanalytic and Psychodynamic Psychology and Division 39 of the American Psychological Association. As a Lebanese American psychologist, Dr. Moussa will be discussing from a psychodynamic perspective meanings lost through language and the importance for therapists to explore associations of language in working with MENA populations. Dr. Moussa, it is such a pleasure to have you on our episode today.
Thank you so much, Jack. It's an honor to be here, and I'm really thrilled to be here too.
Why don't we start off with, can you walk us through some of the clinical and research work that you're doing right now?
Yes, yeah, absolutely. I'm currently, so as you had mentioned, I opened a private practice, so I own a private practice, and I do a lot of work with individuals, couples, and families, both individual psychotherapy and then psychodiagnostic evaluations. I also work with a lot of individuals from MENA backgrounds and populations. The area I'm in does not have a lot of MENA providers, so it's been important for me to work with MENA populations. I also do work with Boston University for religious leaders in formation and for those religious leaders who might need wellness evaluations. And those are really a personality assessment to kind of help understand people's social emotional functioning.
Okay. Now, I did a psychodynamic internship, and I remember doing the Rorschach and TAT. Are you talking about those type of, projectives as part of the assessments?
Yes, yeah. So Rorschachs, TATs, and then other projectives as well.
Okay. So how did that work? Let's dive into today's conversation about, meanings that are lost through language. How did that work possibly shape or inform this idea where you're beginning to question or investigate meanings that are lost within language?
Yeah, well, so I'd say that came a lot from my work in therapy. And so from myself as a bilingual individual and thinking about as I was working with patients and clients that were multilingual and thinking about a lot of the nonverbal communication or things that either couldn't be communicated because I might not understand their language. And I found myself really attuned to what I noticed actually was really where it started was when I would shift languages. So I said I'm bilingual, I speak Arabic and English fluently. And so my undergrad, I went to undergrad actually in Lebanon and then came back here for my doctoral degree. So I have an understanding of psychology kind of in both languages. And when I came here for graduate school and started working with clients, I became really attuned to when my own mind, as like the self of the therapist, would switch into the other language. And that became a real point of exploration for me of what was happening and what might it mean, which then led me down a lot of rabbit holes in research to understand what might be happening in me, but also how to invite that in with clients and with themselves of what might they be losing when they're speaking either in a second language and they're losing their mother tongue.
Wow. Wow. Oh, this is fascinating because I mean, I have a couple of thoughts or just reactions. One is, oh, you were studying psychology in Lebanon?
Mhm. Yeah.
Wow. I mean, for undergrad, and my immediate reaction is, well, kind of related to actually related to language is how was it the theories taught? How did you talk, or how did Western terminologies and constructs get translated? And was it in English? I'm actually curious about all this.
Yeah, so I went to an American university. So most of my classes were taught in English, but it was a lot of sprinkling of Arabic throughout, kind of as we learned. And this joke at the university was, we need a whole different DSM for the Arab countries. Like we're applying these really Western constructs that you can kind of loosely apply, but there's so much nuance that would get missed, right? Like you couldn't find the quote unquote right diagnosis for everybody, or it might not be exactly what it was. So I got really interested in that. And I did a lot of like undergrad externship experiences where I worked in hospitals and inpatient units, in schools, and which were all Arabic speaking. And what I saw there actually was some of where it started to come together was particularly in inpatient units. There was one psychologist who was only an English speaking psychologist. And so I was serving as a translator for some of the patients to the psychologist. And I noticed how much was getting lost in what they were saying and what she was saying back.
Wow. Well, can you actually give us an example? I don't speak Arabic. However, I actually would like to kind of maybe model this or play it through, because I suspect, as part of our Arab American Heritage series, there are actually a lot of, folks who do speak Arabic and are listening to this episode. So can you give me an example?
Yeah. So one example in that setting was there was this older man who we were seeing with some difficulty with substance use. And the way he would describe his relationship with alcohol in particular was he would say, he would talk about the effect it had on his family. That was really the most distressing part. And he would say like, عيلتي هن شقفة مني وأنا عم بأذيهم. أنا بهالشقفة اللي هي عم تنأذى جواتي كلوتي منزوعة وأنا عم بنزعهم لأهلي. أنا عم بنزعهم لعائلتي. Which translates to, right, that he had liver cirrhosis. And he would talk about how his family it translates quite literally to, my family is a piece of me. They're a part of me. And I'm destroying a part of me, and how that affects them, which is so hard, right? Even as we think about it in English, we don't, we might say those things, but there was such an emphasis on this idea that in harming himself, he was harming this physical part of himself, was harming this physical thing in his family that can, I can explain it and understand it in English. And there's something in it that gets a little lost of the interweaving of the family.
Mm, mm. Interweaving of the family, and also some actually the emotionality piece,
Mm-hmm.
because I'm having a reaction when you were speaking Arabic, and I don't even know Arabic.
Yeah.
I felt some sort of emotion coming from the language, but I couldn't quite tell what it was. But there was, for me, a sense of sadness when I heard it.
Yeah. And I think that's true. And some of this kind of why we invite, I think even if we have translators, but it's important to invite clients to speak in the language, is to pay attention to that exactly. Like, what's the emotion coming up when we, even if we don't understand the words, because what we know is that, particularly with the mother tongue, it's such an affect laden language. And so when people can speak in it, and I think, right, when I was describing that man, I felt his sadness, and I didn't know quite how to capture the sadness when I was translating it to the psychologist, right? I can say the words, but I think her hearing him was actually what allowed the sadness to be captured more than my actual words.
Wow. Wow. Thank you so much for that example. It's very illuminating to this idea of just so much is lost through language. I'm curious about from the psychodynamic perspective and bridging these two ideas. Can you maybe share with our listeners either tips or perspectives and maybe how we can think about these as we're navigating this therapeutic space with our clients?
Yeah, absolutely. So when we're thinking from a psychodynamic lens, right, and there's different schools in the psychodynamic field, but especially if we think of the intersubjective psychoanalytic and psychodynamic literature of the co-created space, and the therapist, the self of the therapist is so important in that space. And when we think about how we then kind of show up with those patients, with patients who might, whether we as therapists are multilingual and or when our patients are also multilingual. And so we talk about language being the primary medium of kind of talk therapy. And what do we do, right, when we invite people in psychodynamic therapies to free associate? There's an unconscious connection that gets created between the patient and the therapist, and they mutually create a language. And so as we think about kind of how that language gets created, part of it is the nonverbal communication between them. And so in that, when we think about the role that the therapist has in paying attention to their own experiences. So, there's so much psychoanalytic literature about reverie, right? The Thomas Ogden talks so much about the therapist's own reverie. And that I think is so applicable here, particularly when we think about if we invite clients who are multilingual to speak in their own language, what is the therapist's affective response, but also for those who, for what reverie means is kind of the therapist's own fantasy and thought process. What are the thoughts? What are the things that come up as the therapist when you hear the client speak, and how do we actually share those in a way that then creates a space? What might you associate to as the therapist that may or may not fit what the client is actually saying?
Hmm. And you can do this even if you don't speak the language.
Absolutely, yeah. So similar to kind of how you and I just had that, you talked about the feelings that you had that come up. Another thing might have been if you had any thoughts that came up in your mind.
Yeah. Wow. Wow. Hmm. I'm just kind of sitting here, just thinking about it, and also just feeling I'm soaking all this in because it's so much and yet so little, right? It's just this idea where we're paying attention, but then it's got this feeling, this big impact. Because, I do work with clients, and many of them are bilingual, multilingual. And I think throughout this podcast, I've actually encouraged some of them to, hey, can you just speak in your native tongue or native language, just what that's like? And then I think the psychodynamic perspective that you're adding here too is we are somewhat co-creating a shared language or a space where we're forming a possibly I mean, it's not necessarily a new language, but this melding of understanding.
Yeah, another aspect from the kind of psychoanalytic lens, and if we think about is the dissociation and kind of Philip Bromberg talks about dissociated self states. So that there's this idea that there are parts of us that are not always accessible. And if somebody has a different language that is either kind of their primary language or the language where their affect is coded, which is very common for people who learn a second language, that affect is really coded in that primary mother tongue or native language. And so you might actually lose. We think about kind of code switching, right? And we think about in the analytic world, the dissociated self states that we can't access those parts of the person, and they can't access those parts of themselves in the therapy. And so when we invite them to speak in their own language, it can invite parts of them into the room that may otherwise not have come in.
Hmm. And it creates a different interaction.
Mhm.
Yeah, a different relationship for them to be able to share that with you too.
Yes. Yeah,
Mm.
absolutely. And the kind of level of trust, because I think something that can come up, particularly for some clients where their language has either been fetishized or discriminated against, that there can be a fear of the therapist being voyeuristic, right? Is the therapist just watching me? Are they going to criticize me? And so how do we actually create a space that becomes, I think that's the importance of the co-creation, is so that it does not become kind of, again, a voyeuristic setting that might recreate trauma around their language.
Yeah. Okay. Can you give me an example of what you mean by, fetishizing the language?
Yeah. So one really common example I'd say is like the word Allah, right, which is the word for God. But if we think about the connotations now, right, that particularly if we think about in America, the connotations of Allah are, oh gosh, they're a terrorist, or oh gosh, what might they be saying? When really all they're saying is, or if they say, Allahu Akbar, this, oh gosh, what are they going to do to us? And really all it means is God is good, God is great. But somebody might think twice or three times before sharing that with a therapist, because they might be worried what the therapist might think because of all that's coded into that in our culture.
Wow. We as a therapist also need to acknowledge that that was how we've been coded.
Right.
Yeah.
Yeah, absolutely.
Hmm. Hmm. Well, Dr. Musa, these are such, just they're such interesting and high impact, and it really, I'm just fascinated by this conversation. I'm wondering if you have other ideas or any other thoughts related to, this message of paying attention from a psychodynamic framework and how language is lost, and how therapists can actually use that fruitfully in their session.
Yeah, of course. So, there's one thing that I think we could think about too, is that there's a theory called the multiple code theory, which was developed by Wilma Bucci. And it kind of applies cognitive theory with psychoanalysis, where we think about, as we kind of listen, she has these two terms, symbolic processing and subsymbolic processing, and that you want to link those two. So the symbolic processing is really more about nonverbal or verbal symbols, so that these might be words that we use, it might be sounds, but that it comes in that way. Whereas subsymbolic is more of the unconscious process. It's the idea that we create emotional meaning and we carry out emotional communication. And so when we try to listen on these multiple levels, and I think that's the important piece, as we tune into the subsymbolic, it's tuning into kind of the rhythm or the prosody of the person's voice. And in that, right, what kinds of things might actually be coming up for the person? So I talked a lot about the therapist, right? The therapist tuning in to themselves. Another thing that is important is when the client shares, is actually to ask them, what might have come up for them in that moment. Is there anything that got lost as they try to, if they want to explain it to the therapist? Is there a lot that's lost? Is there a feeling that they're feeling that maybe they don't have words for in English? And can we kind of creatively see if maybe we can both feel it together, even if we can't find language for it?
Wow. Very direct and acknowledging this is the reality. Something's going to get lost. How do we bring this back in?
Mhm. Yes.
Yeah. Wow.
Yeah.
It really makes, I'm thinking this is a skill that's going to make any therapist much better listeners and more empathetic.
Yeah, I hope so, and I think this is right. We're talking about it with multi and bilingual clients, but because I think that's where a lot of this is. But I think it's so true for anybody. If we can pay attention to that nonverbal communication that kind of comes up in therapy, or that comes up in us, even, and what I will say too is for those listeners who are multilingual therapists who are working with maybe non-multilingual clients, when does their language shift, even if not with a multilingual client? And what might that mean within the interaction? So how do we explore that in ourselves? And one example of that was I was working with this older woman, and she talked about shadows, and that shadows were so comforting for her. And she couldn't understand why shadows are so scary for other people, right? This idea. And I found myself associating to the word for shadow in Arabic, or in Lebanese, the Lebanese dialect of Arabic, is khayal. And as I wondered why that kind of popped into my mind, I then realized that khayal means to imagine, means to itkhayal. So it's to imagine with the shadow. And I shared that with the patient, actually, was that I didn't share it quite like that. I said, wow, I wonder if there's a lot you can imagine in the shadows, because I had that my own association, and that freed up so much in her. That we talked about shadow puppets as a kid and what that did, and how much of a joining experience actually that was for her and one of her primary caregivers.
Wow. Yeah, it's really a lot of positive emotions when you're thinking about that.
Mm-hmm.
Yeah,
Yes. Yeah.
yeah, yeah. So, in thinking about just this ongoing work that you're involved with, your dedication and commitment also to our field here, can you share with us any memorable events or circumstances that influenced how you got here?
Yeah, absolutely, I can. So one is what I shared with you kind of earlier, actually, was when I was still in Lebanon and working in that inpatient hospital. And particularly with the American speaking, I worked with two psychologists, one who was Arabic speaking and one who was English. And the difference in the patients who needed the translator for the patients who didn't. And I think that for me really pulled me in a certain way of, oh, I think this is something I really want to pay attention to, and I started really researching it and thinking about it at that time. And some other, there's another formative experience, which was when I was here in the US and I was practicing, and I was working with this patient who I noticed so I really pay attention as I'm talking about the self of the therapist, and my own countertransference, which is kind of my feelings toward the patient. And I noticed that my countertransference with this patient was really different than what I kind of would have expected. I found myself feeling like I was relating to her more. We didn't really have many relatable experiences, but there was something about her that I noticed. I felt that she needed kind of a parental figure, but I didn't feel that way. And I often feel very maternal towards my patients. And I ended up in a consultation, and I was speaking about it because I couldn't quite figure out what was happening. And the person I was with knew about kind of my own interests. It was a supervision, and they knew about my being bilingual. And they said, "Can you actually talk about the patient in Lebanese?" And I said, "Sure." And I did. And as I started talking, I stopped myself and said, "Oh my God, I'm talking about her as though I'm talking about a friend." And in that moment, I actually realized that her transference to me was what kind of Kohut would call that twinship transference, wanting to be my friend. And I fell into it in some way that I really hadn't realized until that moment, and really exploring it in supervision. And then as I went back to the patient, that shifted, and I then was able to be the parental kind of figure she needed. So that was, I think, another one of those, my own doing it, right? Associating with somebody who didn't understand the language, that really freed it up in me.
Wow. Wow, thanks for that example. It is just so clear as we're thinking about this, and did the formative years of experiences that also got you into this work, and specifically this particular area. Now, I'm also thinking about this. We're in the field of psychology, years and years of dedication. So I'm wondering, a common question that I ask all my guests: as a person of color, what were some challenges you faced and overcame that you would be willing to share?
Yeah. What I'll start with, actually, I guess this one is a big one that I would share, was that there's all these stereotypes about the Arabs as terrorists, which is one that I think was very present throughout my life, something that got really said a lot. Don't make Rebecca angry, or she'll blow us all up.
Oh
These
my
ideas.
gosh, that was stated?
Yes. Yeah.
Oh my gosh.
And so as I went into the field, and particularly as I kind of was practicing, and then when things would happen, I'm thinking about kind of a specific clinic that I was at where there was some things that were occurring, and I found myself more hesitant actually to say anything, to not be perceived as the angry Arab who's going to say something. And so found that I worked really hard in the beginning of my training to make everything sound very nice and make sure that I could kind of say things in a way that would be received. As I progressed, I stopped worrying quite so much, but I think it was really the recognition that in myself of, I can't actually change these stereotypes and my own. And I think there's things about that, of being a person of color, of being a woman of color, that, what is the role of a woman of color, that I started to just explore that I'm actually going to use my voice to empower in the places where I can, and to use my own power and just have those conversations. So it's made me much more direct in a lot of conversations and in having those. But
Yeah, totally. Now, may I ask when that shift was? Was it right after you left, or I mean, yeah, when that shift in terms of recognizing, gosh, I've been acquiescing, or I've been sort of catering to a dominant group, and not listening to my own voice and needs. When did it start to shift where you realized, I don't need to do this. I can't change these discriminatory ideas that they're holding?
that, it actually started to change. There was a supervisor who I was very comfortable with, and I started exploring it more with him. And in exploring it more with him, and that was where a lot of it shifted, as he could really hold my whole person and encourage me. And I think that's one of the importance of like those really solid mentors, if we're lucky enough to have them, who really encouraged me to use my voice. And so I'd say a lot of it shifted with him.
Wow. Wow. So for you, what does it mean to be a Lebanese American psychologist?
Yeah, it means a lot of things, but I think the main thing that it means for me is I have a real pull and desire, and I think dedication to working with MENA populations in particular. There's so much stigma around mental health in the Middle East that is shifting in its own ways, and that I've seen shift, but that is still has a lot of stigma. And so I think as a Lebanese psychologist, one thing first is to continue to share that there are Lebanese people, there are Arabs who can understand and who can work with folks from Middle Eastern backgrounds and actually make space for them. That's one thing. Another thing is that I think to be a Lebanese psychologist for me means to really try to empower voices that haven't been empowered or that have been disenfranchised. And Lebanon in particular has such a history, not just Lebanon, but Lebanon has such a history of war and violence and tearing apart. Then it's important, I think, in my own work to give voice to the people who haven't been able to have a voice and who have felt really disenfranchised. So that's a real focus of what I try to do, and to try to work with folks who kind of come from those backgrounds. Some folks that I'd say too, that's what it's meant to me, is people who might be kind of second or third generation Arab, whatever kind of form of Arab, who feel that they have something they want to explore and they might not know what it is, and working through that those intergenerational pieces that they don't even always recognize are inside of them, but that we start to notice kind of in the unconscious, in the one or two words that their mom always used to say before bed that come out and start coming to mind, or these pieces. And so I think that is something that's really important to me.
Yeah. It's like I'm having a reaction or a thought is like for you, in addition to the meaning that is, part of who you are, it being a Lebanese American psychologist, is you're also the piece or the answer to a piece of a puzzle for the different generation folks who may have maybe one or two words that they recall from their parents, grandparents, where they spoke Arabic, maybe a few key words, and then you're bridging that connection. You're filling that gap or the answer to this puzzle. That's sort of the thought or reaction that I'm also coming up with.
Yeah, that's such a great way to word it, because I do think of this work as we're trying to figure it out together. I don't have all the answers and you don't have all the answers, but how do we figure this out?
Yeah, it's like piece by piece.
Mhm.
Together, we're doing this. Yeah. Oh,
Yeah.
okay. And so, Dr. Moussa, how can we support you?
Yeah, so I am, as I mentioned, open to seeing clients who, if anybody might want to reach out, they're more than welcome to reach out to me, and also really open to collaborating with folks about thinking about these topics and writing about this, because I think it is such important work that there's some research on, but it's not that heavily researched, and I think it's really important that we continue. So I'm really open to any collaboration, anybody who might be interested. And then what I want to encourage is that those of us who are multilingual or bilingual therapists to pay attention to those things in ourselves, because there's so much that's important that we can find in our own culture and language. And so I think something that I could encourage in reading is the psychoanalytic work, especially to start, of Thomas Ogden, where we think about the reverie and thinking about how to attend to that reverie in ourselves and working with our patients. I think is just a beautiful place to start as we start to understand.
Well, Dr. Moussa, thank you so much for, such a wonderful conversation and truly just insightful knowledge and really practical guidance for folks who are thinking about this deliberately, of how to examine and explore the loss of meaning in language and how we as therapists can incorporate that more willingly within our sessions with our clients.
Thank you so much, Jack.
A huge thank you to our listeners. If you enjoyed this episode, please share and subscribe to People of Color in Psychology. You can also support us by registering for continuing education courses or making a one-time donation on the Multicultural Counseling Institute's website. Their feedback is important to us, so feel free to send an email, a message on LinkedIn, or leave a voice message on our website. Until next time, this is your host, Jack Sun.